Welcome back, everybody. Now, as was mentioned in the first part of class, in the second half of our discussion of abnormal psychology, what we're going to be doing is transitioning from defining and diagnosing specific disorders into the attempts to treat disorders. And when we talk about this particular approach, or this particular idea of treatment, what we first have to do is qualify attempts to treat psychological issues into two different categories. Now, very often, these categories are not theoretically perceived as opposite of each other, but nonetheless, most psychologists within the field usually tend to go for one approach over the other. The first approach is one that's actually gaining a lot of traction and a lot of interest over the last couple decades, and that's something that we call the biomedical approach. The other one, which we'll discuss in greater detail, is something called the psychological approach. But I first want to focus this class on that biomedical approach because it is indeed becoming much more prevalent and much more common in our current psychological community. The biomedical approach is based on the belief that most disorders, if not all disorders, are the product of some biological alteration of a person's nervous system. Namely, they contend that if we can find the cause, the physical change to that person's system, we can correct it, and in correcting it, we can theoretically help cure that person of whatever disorder they're actually displaying. In this particular approach, the assumption is that there's either some type of neurological, structural, or chemical change that's going on with an individual that's causing the disorder that they're experiencing. In early years, when we talked about treatment for biomedical problems, many researchers used things like lobotomies or what's called electroconvulsive therapy, where we'd actually shock the body into theoretically resetting itself and removing the symptoms that a person was experiencing. Some early biomedical theorists also thought that maybe disease was the root of some of the different disorders that were out there. So strong medications were given to these individuals in an attempt to fix what was going on. Nowadays, we still use some of the same terminology, but their approaches have greatly differed. The more common thing that we do to help treat individuals nowadays is to prescribe what we still call medication, even though this medication is very different from most of the medication we're familiar with. Medication in the biomedical treatment approach usually attempts to find a way to assess, or I guess fix, some neurochemical breakdown or neurochemical imbalance that most biomedical researchers believe is the root source of specific disorders. So if you're suffering from some type of depression, the idea of medication is that we can give you a specific drug or a pill that causes a neurochemical balance to shift within your body, and in doing so, essentially relieve you of your symptoms. And one of the reasons why medication has been so popular over the last couple of years is the fact that when we look at its effectiveness, we do see that medication has really unbelievable success rates. Namely, if a person takes a pill when they're suffering from a specific disorder, oftentimes many of their symptoms will go away within a matter of hours. And this is for a number of different types of disorders that people can develop. And not only do their specific symptoms go away, but often accompanying symptoms also seem to go into remission or be removed entirely. That fast-acting and widespread benefit of medication has enticed a lot of people within the psychological community to prescribe these things, and not only to certain individuals that are struggling with specific disorders, but a large sample of people that are just mildly suffering from some of the symptoms associated with different disorders. Lots of psychologists now have started to question whether or not this is the best idea. One of the major concerns that people have is that we might have too many people on medication. In fact, the idea is that some people might have been able to help themselves or easily kind of just have time pass and have a lot of their symptoms go away. but because of this fast acting technique, because we know it works fairly well, oftentimes doctors nowadays are pushed to just prescribe some type of medication to immediately remove the symptoms that are there. When this happens, there can be some side effects. One of them is the fact that people start to be either physically addicted to these neurochemical drugs, or more oftentimes they can also become psychologically addicted. They might grow to feel that they need those drugs, even if they were only struggling with minor things when they started them in the first place. Another problem is the fact that as these drugs continue to be used, our body starts to tolerate them more. Our neurotransmitters return back to the level that they were when the problem started emerging. And the only way to fix that is to give more of a specific drug that was being applied. That, or combine that drug with another one that's known to help ameliorate some of the symptoms that are common with the different disorders that are out there. Another problem we have is that as these drugs continue to be prescribed, their effects do start to wane. Even though instantaneously almost all disorders are somewhat subdued with drugs, oftentimes those effects stop working, or those effects stop emerging with time. And one major concern that lots of psychologists are now coming to conclude is the fact that when we start prescribing drugs, there seems to be no theoretical ends to these particular treatments. When you pair that with one of the major concerns that more theoretical psychologists have, namely the notion that they're assuming when prescribing drugs that the imbalance of neurotransmitters is the cause of the disorder, but it might not be that. And then we can see why this is a problem. If you want to think of why, I guess this last issue is so big, consider your brain something synonymous to a car. So let's pretend that you have a car and it happens to be leaking oil all over the place. Well, if your car started leaking a fluid and you brought it into a mechanic, one of the things the mechanic might do is immediately put more of that fluid, more oil, into your car. But if the mechanic was a good mechanic, that wouldn't be the last thing that it did. He or she would obviously need to figure out what was the source of this particular leak. Putting that balance back in was good, it was necessary. But if you don't ameliorate the problem, the cause to the imbalance, then you're going to have to fix it again in a very short period of time. This idea is what lots of psychologists believe your brain is like. If you have a specific problem, you're going to start losing things, or you might have imbalances or structural problems within your brain. But most psychologists believe that those structural issues are not the source of the problems, but merely a side effect. Yes, taking drugs can help get rid of some of the symptoms, but you're going to need to keep taking the drug over and over again until you get to that source. This idea often leads researchers to try to avoid just using medication. But some have argued still to this day that medication is all we need to help treat people with specific types of disorders. Another common thing that we prescribed nowadays is something called psychosurgery. Actually, I take that back, it's very uncommon. In fact, in the past it was used on a regular basis, but nowadays it's only used in very extreme cases. When people have had, say, a specific tumor that's pushing on a region of their brain that's causing a problem, we still can do some types of psychosurgeries. If the brain seems to be swelling or having an abnormal growth that's causing major symptoms, we can commit these psychosurgeries. But nowadays, lobotomies, other types of kind of major severings or connections no longer happen. Instead, we've kind of moved to either medication or the alternative, one that most psychologists greatly prefer over the other, called psychological treatment. Psychological approaches to therapy, or psychological attempts to help a person with a specific disorder, are based on the notion that when we look at most mental issues, they're a product of some psychological/social interaction And that the best way to cure this particular problem is to have or develop a relationship between a trained therapist and that particular individual in order to help them theoretically overcome their psychological or social or whatever the kind of root base is of their issues, and to try to help them really improve upon their behaviors, their interpretations, and their thinking to reduce the symptoms not only at the moment but in the long run. When we talk about psychological approaches, though, there are a number, a huge, vast number of different types of psychotherapy that are out there. The first and most prominent type of psychotherapy that was ever introduced was psychoanalysis, Freud's big idea. As a review, what Freud thought when we talked about psychoanalysis was that we should be able to tap into somebody's unconscious in order to get at their hidden desires, their hidden needs, their hidden traumas that were the source of most abnormal behavior. So psychotherapy was one of his common techniques that he would use. But in addition to that, he would use techniques that we talked about before, like free association, dreams, and hypnosis, all in an attempt to help a person get at those unconscious feelings, those problems that we have that we need to bring to the surface. The major issue with psychoanalysis was the fact that it's extremely expensive. It requires a large amount of time, and the process of actually trying to help somebody takes many, many years. So not only do you need to see a doctor and spend large amounts of money on this doctor every single day, but in the long run, it's not going to be something that you can fix in a very short period of time. This has led a lot of people, whether or not they really believe in psychoanalysis, to kind of stray away from this approach and instead pursue other avenues that have gained a lot of support and, I guess, a lot of credibility over the years. One of the more common techniques, at least for specific types of disorders nowadays, is something called behavioral therapy or behavior therapy. Behavioral therapy is operating on the premise of what we talked about earlier with the concept of behaviors. Namely, what behavioral therapists believe is that most people's disorders, most people's problems, can theoretically be fixed or changed if we change the person's learned connections and the way they essentially operate in the environment. So very often, behavioral therapists will use classical conditioning and operant conditioning in ways to help an individual overcome specific types of disorders that they are encountering. Now, behavioral therapy has been proven to be very successful for a number of what we call anxiety disorders. It's also been used for drug issues and somewhat successfully with anorexia and bulimia. But more often than not, when we talk about behavioral therapy, we only talk about kind of using it in situations where we can visibly see the manifestation of a person's disorder and try to visibly alter those particular behaviors. However, when we focus on these, there are some situations, in particular phobias, where behavioral therapy has been proven to be exceptionally acceptable. In fact, it's more effective than almost any other approach that we're going to be talking about in this class. And just to get a sense of what this behavioral therapy is like, what I'd like you to do is go to the video linked to this particular class, behavioral therapy for, I guess this is a fear of snakes that you're going to see. So you can see how this process works and why so many psychologists are interested in it in very specific situations, namely because of how quickly it works and how effective this treatment might actually become. For those of you that saw the video, I hope you enjoyed it. This next topic, or this next approach that we're going to be discussing, is something called cognitive therapy. Cognitive therapy operates somewhat like the field of cognitive psychology does. Namely, it argues that when we're talking about specific disorders, the person's cognitions, the person's sense of what's going on, could theoretically be the basis of a number of different disorders that are out there. So, what cognitive therapists do is attempt to change the thinking or the processing of an individual to get them more aligned with people around them. And when we talk about thinking and changing things, what a lot of cognitive therapists do is pick different types of things to address. Usually, when we talk about cognitive therapy, we break it down into subcategories. Two of the more prominent ones are listed below. The first one is called rational emotive behavioral therapy. What it argues is that when people are essentially encountering people in the environment, oftentimes disorders are displayed not because of the way they make sense of things or anything they're particularly doing, but they manifest themselves because of the reactions, the emotional reactions that people have to unpleasant experiences or just any experience altogether. So, if, say, you struggle with a test in class, if you're a fully functional individual with no major issues, you'll probably be upset, you'll probably be bummed, but it won't cause you to kind of have exceptionally large emotional breakdowns or kind of links where you're very angry or very sad or very anxious depending upon the disorder that you're suffering from. So what rational emotive therapists do is try to get people to kind of curtail some of the emotional reactions that they have. Sometimes it has to be forced to begin with, but the idea is with time, if people learn to kind of react less strongly, to really control their emotions, theoretically the disorders can go away. Cognitive behavioral therapy, another branch of cognitive therapy, focuses less on kind of the end product of experiences, but more on how people approach and understand the experiences that they're actually in. So if you're taking a class and you cry because you're having a tough time with it, that would be something a rational emotive therapy would address in terms of the crying. But a cognitive behavioral therapist would try to figure out what's causing you to interpret that situation as being so stressful or so problematic. So, what a cognitive behavioral therapist will do is focus not on the tail end, but the beginning of the problems that might be coming up. They'll get people to reinterpret or reevaluate how they're seeing themselves, how they're seeing their situations. And in the long run, theoretically, after working on this over and over again, people will start to see the world more clearly, and a lot of their symptoms, or a lot of the disorders theoretically will go away. Cognitive therapy, again, just like behavioral therapy, does work really well with specific types of disorders. But sometimes it's not quite as effective as some of the other ones. However, if we're going to probably choose between all of the different therapy treatments, cognitive therapy and behavioral therapy are two of the more prominent ones that we use today. And it's because they seem to be very effective in a number of different ways. In particular, cognitive therapy seems to be able to help individuals with a huge number of different disorders that they're manifesting. When we talk about alternatives to these particular ideas, more of a kind of spiritual positive basis idea, oftentimes what people will do is turn to something that we've talked about earlier when we talked about this concept of positive or humanistic psychology. Namely, the work of Carl Rogers is not only applied to understanding personality, but also to how we might be able to actually help people that are struggling with specific disorders. Rogers, as I neglected to mention earlier, was indeed a therapist for most of his career. And what Rogers intended to do in his work was try to help people by allowing them to essentially get those selves, the ideal self and the actual self, more aligned. In essence, he thought that when we can get those selves together, many disorders will go away. And in his approach, what he thought we would do to do this or to accomplish this was to let a person kind of explore themselves and try to cure themselves in the process of therapy. His particular approach is now known as person-centered therapy. And in this particular approach, clients come in to see these therapists, and the therapists do not necessarily direct the conversation, but instead they allow the person who's talking to them, the client, to just have the conversation go where it goes. In these meetings, it's thought by Rogers that you should be very accepting of the person, regardless of whether or not you approve or disapprove of their behaviors. And instead of telling them what they should think about or asking them questions, what Rogers insists is that when you're in this person-centered therapy, you just mirror back, reflect the words or statements that a person's actually saying. This can be sometimes very, very attractive to some clients, feeling more empowered because it's going on, feeling like somebody's there to support them. But it can also be somewhat annoying for some clients if they don't necessarily like somebody just sitting there repeating what they're saying, smiling and nodding the entire time in a conversation. It can get a little frustrating. So, humanistic psychology is definitely not for everyone, but statistically, and this is important, some research has shown that it does work fairly well for a select number of individuals. Now, to give you a sense of these two approaches, in particular humanistic approaches and cognitive approaches, which again are by far two of the more prevalent ones that are out there today, what I thought we'd do is watch a classic set of videos. Around 30 years ago, there was a researcher who led this humanistic movement named, again, Carl Rogers. And what Rogers wanted to do was compare his particular approach to some of the other ones that were out there. Now, there was also a Gestaltist approach in this long video that he had, but the two ones I want you to be familiar with is the humanistic approach and the cognitive approach. The two links that you see there will link you to these approaches. One, you'll see an interview with actually Carl Rogers and this woman who will be seeing two different therapists. And what I want you to do when you're watching these videos is really compare the way the therapists actually interact with this woman. And what you'll get from this is kind of a stark contrast in how psychological issues are dealt with when you compare these two particular groups. After you're done watching about 4 or 5 minutes of the interviews, you can feel free to kind of move on to the next slide. I don't expect you to watch all 10 minutes of them, and you certainly don't have to watch all, I think it's 6 parts of the video series. But I do want you to at least have a sense of what these therapeutic techniques are like, because sometimes telling you about them is much less effective than you actually seeing them in process. So again, please turn to these videos. You might want to kind of speed through Rogers talking for a while, unless you want to hear about his theories and his ideas. You're more than welcome to do that. And then watch a couple minutes of each of these interviews wherever you want, so you can see how this particular therapeutic technique, or actually both of these therapeutic techniques, work. All right. Welcome back. Now, in addition to those topics of humanistic psychology and cognitive psychology and behavioral psychology and psychotherapy, kind of the major techniques that are out there nowadays, lots of other therapists, because of our current society, because of current demands, have also moved in new directions, essentially developed new techniques that operate on some more, I guess, logical concepts than ones that are necessarily based in any particular theory. One of the main types of psychotherapy that has emerged over the years that really is considered a distinct branch of psychotherapy is something called family systems therapy. Family systems therapy operates on the notion that many people's disorders, many people's problems, might be embedded in the dynamics of their families. So a person might have problems with their parents, or their siblings, or their children, or people around them that are exceptionally close. And the theory is that to help them, they not only need to help that particular person, but they have to help the people around them. They have to reestablish roles, introduce into each other to, each person to each other, and they have to kind of establish a new relationship or a new family dynamic in order to truly help a person overcome all of the different things that they're struggling with. Another type of therapy that's out there is one that actually operates less on kind of an ideal or a concept, but more on a situational need. And it's something we call brief therapy. In fact, out of all the therapeutic techniques that we've talked about thus far, one of the more common ones prescribed nowadays is actually brief therapy. It's not necessarily because it's been proven to be significantly more effective. Instead, we see brief therapy being used a lot nowadays simply because it's significantly more cost effective. With brief therapy, what a client will do is see a therapist. Oftentimes, it's not even somebody with a PhD or training in psychology, but instead an MD, a doctor that is. And this particular person will see the doctor for around 10, 15, maybe 20 minutes if they're lucky. And the doctor will not really talk with them about their problems, but instead kind of get a sense of what they're struggling with and then quickly move on to coming up with a game plan for the next couple weeks or months that this person can kind of use to approach their disorder that they're having. So they'll set out ideals of how to behave, set some goals as to what to accomplish, and then not really see that person for an extended period of time. The reason why brief therapy is so popular is because it's significantly less costly. And unfortunately, with most people needing insurance to actually see a therapist nowadays because of how expensive therapy is, the only type of therapy that many insurance carriers will cover is this brief therapy approach. And oftentimes what we see is that brief therapy is paired with this medical approach that we talked about earlier, or the biomedical approach. In particular, people are given medicines very often that pair them with this brief therapy technique. It's not that brief therapy doesn't work, but a number of studies have suggested that might not be as effective as any of the other major techniques that we've talked about thus far. Another kind of new technique that's a result of insurance issues and monetary issues is something called group therapy. And in this particular type of therapy, what happens is there's one therapist and many patients at the exact same time, or clients at the same time. And all of these clients are theoretically struggling with similar problems. And the idea of group therapy is that because they're all struggling with the same ideas, they might actually be able to help each other and relate better with each other because they see people who are suffering from the same things. So they have kind of hints or tips or ways to help other friends or people that they're meeting in these things kind of overcome their problems. Now, there seems to be some theoretical basis for this, but there are some issues with group therapy again. In fact, sometimes a number of researchers have argued that if we have group therapy sessions, we might actually be exacerbating the situation. Say if you've got a group of people who are struggling with alcohol issues, well, there's lots of people that can learn different techniques of how to hide alcohol from their family members or actually find drinking buddies in these group therapy techniques. It's certainly usually more beneficial than costly, but there are those concerns out there with group therapy techniques that don't usually pop up with some of the other therapeutic techniques that we've talked about thus far. Another type of therapy that's very similar to this is something called self-help groups. The only difference between self-help groups and group therapy is the fact that self-help groups don't have a therapist running the session. Instead, it's just a collection of individuals who have either suffered with or are still suffering with a specific disorder trying to help each other. Self-help groups usually have been linked to more religious backgrounds. One of the more common ones is Alcoholics Anonymous. But there are a number of self-help groups that do not operate under any religious premises. And when we look at these self-help groups, again, we see much more cost-efficient, much more comfortable settings for a number of individuals. But again, therapeutic techniques that seem to be theoretically slightly less effective than some of the other ones that we've talked about. The last therapy type that you see listed there is one that's kind of an oddball. We call it eclectic therapy. And the reason why it's weird is because it really doesn't fit into one category, but that's by intent. Anybody described as an eclectic therapist is somebody that dabbles in a number of the different approaches that we've discussed thus far. In essence, eclectic therapists try to tailor their therapy to the person that they're dealing with. And to do this, they have to be trained in many of the different approaches that we've discussed thus far. More and more of today's current psychologists are being trained as eclectic therapists. In the past, it used to be considered kind of a bad word, but nowadays Recognizing that each individual has their own needs, recognizing that each individual has their own preferences, has led a lot of people to see the benefit in this particular approach. And oftentimes, instead of just changing the approach from person to person, many therapists have also started integrating the strengths of each of the approaches that we've discussed thus far in order to make really the most beneficial interaction possible with the clients. Now, some people don't necessarily like the eclectic idea. They still think that their particular branch is significantly better than the rest. There's no reason to try other ones. But there are, again, many people who nowadays don't necessarily think one is automatically better or one approach is automatically better than the rest, and instead do opt to kind of integrate all the different approaches when they see them actually helping or benefiting the client that they're dealing with. Now, what we've done so far is kind of discuss the different types of therapy that are out there. Fortunately, this is the point in time where I have to start kind of speaking with many, many words of caution. We often see in an abnormal psych class, and in particular in an introduction to psych class where we start talking about abnormal psychology, is that once people start to learn about these things, they start to want to either treat others or start to diagnose themselves. I need to warn you, that's a very dangerous path to go on because it takes many, many years for psychologists to actually be trained in this particular field. Even after many years of training, these psychologists have a number of years where they have to be supervised before they're allowed to help individuals on their own. But nonetheless, I know, even though I suggest it, many of you are now very attuned to possible problems that you might have or possible issues that loved ones might be having. And you might be considering different types of therapy that you could pursue or looking into maybe figuring out what's wrong with you or that person that you know. Some of the major questions that you might have is, with my issues, would therapy help? And if so, which therapeutic technique would work? And why see an experienced therapist over just talking with friends? Well, what I'd like you to do, if you haven't already, is read the end of the chapter that is, I guess, attached to this particular lecture. And there will be a lot of information talking about these questions. It's impossible to really address them over a microphone. It makes for a dangerous situation because as much as I want to help you in your school, I need to stress that I cannot help you guys or loved ones with psychological issues. There's many, many barriers to that, and there's a strong need for individuals to really seek somebody that's trained as a specific therapist. So instead of me lecturing and giving you the incentive to try to contact me about this stuff and making things very stressful on everybody's end, I really suggest that you read the text, go over this information so you can get some more hints or more topics about this stuff. If you happen to be one of those individuals that this is not applying to you, if you just do not think there's any psychological issues that you have and everything's fine, don't worry about this. I have no intention of assuming that everybody in this class does need therapy. But in the past, I've come to learn and know that there are those individuals that do want to kind of discuss this as we progress into this session. And that's where that section in the chapter is really, really valuable and can help you kind of get some good resources along the way. That marks the end of today. Thank you very much for listening. I hope all of you actually took the time to see those videos because they can be very, very interesting if you watch them. In the next class, we are going to be moving on to our very last lecture of the semester. We'll be talking about very specific disorders. We're talking about the three major clusters of mood disorders, anxiety disorders, and something that we call schizophrenia. Until next time, enjoy your days. Make sure you get those posts up, and I'll see you all soon.